So there's another question from our audience. If each of you had the opportunity to get the administration's ear around one topic or theme that you think could meaningfully improve healthcare in this country, what would that one thing be? That's a great question, by the way. So your pet issue, the thing you would plant in someone's ear to say, pay attention to this with a clean slate, so to speak, of policy making in front of us, what would you be talking about?
I'll start. Behavioral health, access to behavioral health care providers, making behavioral health a priority for healthcare delivery and for access to care. I think it's a very difficult thing to address. I don't think that's a very controversial topic. And if we had to, move the needle on the health of our country, that's one place that I think there's a lot of room for movement.
I'd be focused on how to make, if we're not going to have wholesale changes, that's the thesis, how to make what we have work better. Forget about what you think about politically about subsidies, et cetera, but the conception of the ACA originally was to get insurance more affordable to people that weren't buying it to give them coverage. But I think we conflated the concept of health care and health insurance, that people believe that health insurance equals health care, when in fact it's an insurance product as opposed to the delivery of actual health care. So when you think about, how where the ACA has failed in my mind is it hasn't achieved any of the economic consequences or expectations in terms of what it would mean from a budgetary point of view, et cetera. And I think that has a lot to do with benefit design, that the benefits are often richer than what people want to buy. And I'd love to see the ACA rebuilt along, with some products in it that people really will buy without having to require a subsidy, which would mean less essential benefits, but a lot more catastrophic coverage.
I go back to maternal health. 50% of our births take place in Medicaid. We have a lack of consistency in payment and care that takes place. And we know that the investments that are made at the very beginning of life and the first 3 years after have a huge impact on health outcomes, both for mom, baby, and family. And so the reality that we have consistency in the Medicare space in the dusk, but again, at that dawn of life, we do not have any consistency. And we have the worst maternal health statistics of any, industrialized country in the world. And so if there's a place where we could be putting more time and attention and really think from a clean slate perspective, that's where I would put it.